Good evening, class. Have you ever wondered about the evidence-based approach for educating patients? What methods are available for nurses to use for educational purposes? My name is Michelle Baxter, and today we are going to explore interactive patient education. Research has shown patients who are more engaged in their care are likely to have better health outcomes and reduced healthcare costs. Healthcare organizations are now focusing their efforts in finding ways to improve patient engagement. At the forefront of this movement are patient engagement technology systems to generate interactive patient education plans. Today, we will cover the following topics and create greater awareness for nurses to utilize interactive patient education, or IPE. Interactive patient technologies which are helpful in supporting patient self-management. We will look at a case involving a patient using interactive technology, the various IPE available, and revisit the case study to examine the effective use of IPE for patient treatment. Patient education has changed, moving from a healthcare professional deciding for what's best for a patient to a patient empowerment where treatment decisions are made in cooperation. Traditional patient education relies on written material about disease processes, medication, medical management, and self-care instruction guidelines. Technology has modernized methods in which patients are educated while eliminating the traditional health pamphlet provided before discharge, leaving the patient uninformed. Today, patients benefit from many forms of education, including television, video, internet, or utilizing electronic devices. Interactive technology provides portable patient education that can be utilized anytime from anywhere. iPads and tablets, as interactive technology, use apps that enable patient education information in a customized view that could be significant in improving patient care and experience. Nurses during rounds show their patients diagnoses, including the images on a tablet together with the information to help visualize what is happening with their illness. Tablets make patient education mobile and more accessible due to the videos, interactive tutorials, and diagrams, which help them understand their illness better than just words can, provided patients with a glimpse of their clinical care information that makes their hospital stay less stressful. Patient portals are being accessed through the internet for scheduling, viewing medical results, and for messaging between patients and providers. Video chat, instructional videos for pre- and post-operative patients combine all of the patient's medical records into one. Mrs. Wickman, a 52-year-old woman, presents to the hospital complaining of 3 days of increased shortness of breath. Her dyspnea is worse with exercise and relieved somewhat by rest. She has had to prop herself up in bed to avoid feeling like she's drowning. She also complains of swelling in both ankles. She has developed a cough productive and it's resulting in pinkish colored sputum. This is a new diagnosis for Mrs. Wickham. She is unaware of what chronic heart disease is and needs lots of information regarding her diagnosis and the changes she will need to make in her lifestyle. The nurse sits down with her and discusses her strengths and challenges. She discovers that she likes interactive activities and likes to be able to pause and soak up the information as opposed to just cranking through it all and learning. Together, they work on a plan to help Mrs. Wickham learn about the important pieces of her new diagnosis and how to be successful at home. Together, they decide the use of a tablet makes learning interactive and mobile and can be brought bedside while in the hospital prior to discharge. The videos, diagrams, and animations on these devices increase her comprehension about her disease and allows for the learning to take place that best suits her. Easy access to videos and illustrations play a vital role in aiding conversation between her and her nurses and other caregivers. Custom-developed mobile and tablet apps can help facilitate patient learning via video, animation, and illustrations specific to her disease. Augmented and virtual reality on the tablet also is effective in patient education and can make it easier for understanding her complex healthcare related disease process. Application has assisted in overcoming barriers such as reading and visual defects, as material can be read out loud, translation into various languages, and internet or device access limitations. In the case of Mrs. Wickham, a tablet was used at bedside to review her disease process. She was able to watch videos, participate in interactive media, and evaluate her knowledge of the following topics: activity level, her new diet, medications that she's going to be placed on, the importance of weight monitoring, her follow up care, symptoms that she is expected to report, when she should call the healthcare provider, and she was able to participate at her own pace. If she had questions, nurses were present to answer her questions before she left the hospital. Nurses could also evaluate her performance and determine areas that required further teaching. This empowered Mrs. Wickman and gave her the confidence to manage her disease process at home. Technology has given healthcare organizations an opportunity to digitalize patient interaction, a space that has been long dominated by analog tools such as posters, pamphlets, and models. Patient education not only improves the healthcare outcomes, but it boosts the patient engagement, which in turn affects the patient experience as well as satisfaction. Thank you, and I hope you enjoyed this presentation.